Great. So good morning, everyone, and welcome to CAHN Health Hour. This is a regular session every Saturday morning with the same meeting ID, where we have the privilege of having medical professionals, predominantly from the Caribbean and African community, having a time of engagement with the community based on particular subjects or topics. And this morning, we really grateful to have a very great friend and advocate and support of CAHN, Dr. Mohammed Kamara, who is an emergency medicine consultant at the Tameside Hospital here in Greater Manchester. So Dr. Kamara has done a few of these, and this morning he's going to focus on hypertension, prevention, management of high blood pressure. So over to you, Dr. Kamara.
Good morning, everybody. Can anybody hear me?
Yes, morning.
Yes,
Morning. Right. Thank you for having me.
Doctor.
Thank you for having me once again. I must have been doing something, what, is it wrong or right? For you to want me to come back. Anyway, it's a big topic. Now, when I did this, even to the juniors, I had to do it in two parts. So whether you would want that or not is what I'm not sure about. However, we'll have a go and see where we end up. So what we're going to be trying to look at is probably an overview of hypertension or high blood pressure. What are the symptoms? What are the causes? How do you diagnose blood pressure? Understanding the readings that you would get when you get to measure them, like for example, going to the GP. How do you treat hypertension? And what medications you'd use, what home remedies you would use, what diet you would probably be advised to develop or adopt. And there is a particular type of hypertension which I think we'll not go into, but we'll just mention it, which is hypertension in pregnancy, which is very important because it leads to a lot of complications and is very life-threatening when it happens. Therefore, it's worth mentioning. The effects of blood pressure when it's high on the body itself, and how do you prevent the pressure going up. So what is blood pressure? Now, blood pressure is a measure of the force that your heart uses to pump the blood around your body. Again, it's a measure of the force that the heart uses to pump blood around your body. Now, how is it measured? It is measured in millimeters of mercury. You'd probably see that mmHg, and it's given as two figures. The upper figure is written in two figures, the upper one and the lower one. The upper one is systolic, and the lower one is diastolic. Now, the systolic, the upper one, is the pressure when the heart pushes the blood out, and the diastolic is the pressure when the heart rests between the heartbeats. So, for example, if your blood pressure is 140/90, it means that you have a systolic blood pressure of 140 and a diastolic blood pressure of 90. As a general guide, the ideal is 120/80. Sometimes, depending on the sex or the gender, they might say 90/60, because most young women do have a blood pressure of probably 100 or less, which may be normal for them. By the time it gets to 140/90, it's then considered to be borderline. And anything above that or beyond that is definitely classed as high blood pressure. On the opposite end of the spectrum, you do have what we call, or what we term, low blood pressure. This is considered to be, as I say, below 90/60. So as it is, the types of blood pressure that you do have are high and low, which you just mentioned, So you have high blood pressure, which sometimes results from the lifestyle habits, which would be unhealthy, smoking included, drinking too much of alcohol, being a bit on the heavy side, and obviously not indulging in exercise enough. Now, if left untreated, clearly the blood pressure would increase and will cause serious long-term health conditions, the likes of heart disease, angina, heart attack, strokes, and of course the kidney can get kidney failure, you know, and things like that. The low blood pressure obviously can be caused. It is less common. That's something you would probably be aware of. But clearly it can be caused by medicine. For example, people that take codeine or morphine would actually tell you that indeed they feel dizzy after that, like the likes of the patches. If you put a patch of a painkiller, which is like fentanyl patch or maybe a morphine patch, clearly the very first day you take it, sometimes it might make you feel a bit dizzy. So the pressure goes down because of that, and that's one of the side effects of that. There are other things that could cause the pressure to go down, which would include heart failure, and of course, the well-known side effect or the effect of dehydration. If you don't hydrate yourself enough, or if you have diarrhea and vomiting, that can lead to the blood pressure dipping. But before I go further, I wanted to just ask this question to the audience. So I don't know, Charles, maybe you might unmute the audience for them to have a go at this. It's just important to probably get them to understand that there is all right, we're having a
Money is digital. The climb, but they talking that shit. Don't understand it, don't play by the rules. Don't give a fuck who can get hit. You talk about family, that's all that I got. My brother, my sister, my mama, my pop. These niggas keep playing, they fuck around, get shot. I'm always myself, ain't no time for no thought. I know what I said and I know what I did. They always be shitting, but I got the click. If you ain't on top, then who the fuck is? I don't really care, cause I got it written. Cause they gotta
Charles,
catch me.
can you mute everybody?
Can you mute everybody, please?
Till I fumble, I'm up in the six. Yeah. Gas. Ain't while I'm whipping the stick. Dumb. Now while I do my little dance in this beach, you shopping, she.
Apologies about that, Doc.
You've got an intruder, so you need to manage that with the co-host, please.
Yeah, over to you, Doc.
Is everybody, have you muted him?
Yeah, we okay. Dr. Kamara.
Can you hear me?
Yeah, we can hear you now.
Right, I don't know what's happened.
Yeah, apologies. I think we need to go back to the slide where you had the icebreaker on there.
Yeah, here we go. I was asking the audience whether anybody knew or knows which animal is immune to all known diseases.
Yeah, I would encourage people to use the chat box.
Yeah, if you can, that'd be good. But failing that, we'll go forward anyway.
So someone has mentioned turtles.
Right, incorrect, sorry. Anybody else? Come on, don't be shy.
Sharks.
Sharks, that's it.
Sharks.
Who said sharks? They're very clever, that's right.
Neville Levy.
Good, excellent.
And Jenny as well.
Good. Yeah. So, I mean, the blood pressure actually happens as it is to go up when the arteries get narrow. So if they're narrow because of the hormone called angiotensin, it increases the resistance. And the narrower the arteries, the higher the blood pressure. Over the long term, this would cause health issues, as we just alluded to earlier on, including heart disease. Now, the importance of hypertension is such that the World Health Organization decided to dedicate a whole day. Can you imagine that? A whole day to hypertension. So on the 17th of May, the world, I wouldn't say celebrates, but actually sensitizes and increases the awareness of hypertension and its hazards. So 17th of May is World Hypertension Day. So what causes it? The blood pressure we're talking about. Now we have, as I said, primary blood pressure and secondary blood pressure that is high. So hypertension can be because of the genes, which, as I say, you can't do much about because you don't choose which family you're born in, which genes you can inherit. This is all in the hands of the creator. However, if you have inherited the genes that are not so good, I wouldn't say bad, but just not so good, because if you inherit the genes of hypertension, then clearly you could manage that. You could do things towards making them manageable. If you balance, you know, what you do in terms of your lifestyle and your stress factors and your health, i.e. the foods you eat, the kind of lifestyle you lead, the job you do, clearly you'll probably manage that. But secondary hypertension, now definitely this is acquired. This often occurs quickly and becomes more severe than the primary hypertension. The primary is something that grows in time, but this one is something more quickly. It's more like a sudden. And normally what triggers that is things like kidney disease, things like obstructive sleep apnea. Now, I don't know if you know about that. If someone, you know, has suddenly started snoring a lot when they're on their back, and then along the line they started, you know, choking and fighting for their breath, and they're really a bit overweight to be on the heavy side, that may well be obstructive sleep apnea. So therefore, that might need looking at. There are things like congenital heart defects, which weren't picked up. So if you came from, you know, the, so to speak, third world, Afro-Caribbean, and you've not been screened, and maybe you don't know you have this, but yeah, it was tiny. The hole you have in the heart was tiny, and then all of a sudden, as things go on, your heart copes with it for a long time, then starts to decompensate, starts to show strain, then you could actually get those problems. The pressure can go up because of that. If you have a thyroid gland, you know, the gland that sits in front of the neck, it's a very tiny one, small one, which when it grows bigger becomes a goiter. So if you got a thyroid problem, overactive thyroid, clearly that would give you the pressure to go up. Medications themselves can make the pressure go up. Use of illegal drugs, can actually make the pressure go up as well. Alcohol misuse or binging and things like that can get the pressure to go up. There's a gland sitting on top of the kidney called the adrenal gland, which produces a lot of hormones, you know. That as well, if it gets like a growth in it, can actually cause the pressure to go up. And of course, there are certain tumors like insulinomas, which you might not know about, but clearly they can cause that. Right. So we talked about this. The systolic is the top pressure and the diastolic is the bottom number. If you actually are seeing your GP and they ask you to come a few times just to check it, to make sure it's being, you know, at an accepted level, then they could do tests. But if it's not, then clearly they would want you to do your urine test, see what your cholesterol is doing, whether it's high, low, or being stable. They can ask you to do an electrocardiogram, that is like the heart tracing, which you can do even at the GPs nowadays, and that will give an inkling or understanding as to what the heart's doing. If it's straining the left side of the heart, you would definitely see it on an ECG. Sometimes they can do an ultrasound of your heart, which we call an echo. Some people may have had it, but they might ultrasound the kidneys. That would show you whether the kidney has shrunken or whether it's got bigger, what we call hydronephrosis. You know, so you have the stages on your right hand here. You can see the stages of the blood pressure. So if your blood pressure is 120/80, that is classed as healthy. But that is just relative because it could go down and it could go up. The reason why I say that is that if someone has got a normal blood pressure of 180/100, and all of a sudden you see them in a hospital, and the blood pressure is 120/60 or 120/80, clearly you have to worry about that because that is not a normal blood pressure for them. So that's definitely when we talk about normal, we're talking about it relatively. In someone who's young and healthy, 120/80 is fine. Sometimes you hear people talk about this figure 140/90, 140/90. That is important to remember because that is the borderline blood pressure. By the time it gets to 129/80, or 130, should we say, it becomes known as elevated. And when it goes to about 140/90, 140/90, then clearly it is now stage 1 of hypertension, high blood pressure. When it gets to 150 and above and 90, is definitely stage 2 of high blood pressure. And by the time it gets to 180 or above that, sometimes over 200, and the bottom figure is 120, now that is hypertensive crisis, and that needs immediate attention, which would mean you have to go to a hospital to get that checked and get that stabilized, especially if you are known to be hypertensive and you're taking your blood pressure tablets and they don't seem to be controlling it. So we've just talked about it. This is just a slide to show if you're on the green, as I say, below 130/80, then clearly the doctor will pat you on the back and say, you're doing a good job, keep on the good work, and stay on the healthy habits. If it goes to 140/90, then they would advise you to make some lifestyle changes in order to lower the blood pressure. By the time it gets to 160/100, you definitely, without a shadow of a doubt, need to see a GP. And definitely, when it gets to 180/110, then clearly the GP needs to do something drastically, desperately soon. And by the time, as I say, 110 or 180 and over 110, then clearly you need to be coming to an emergency department to get that sorted out. Otherwise, it can lead to things. Now, a lot of people hear about blood pressure, but they don't know what symptoms you can associate or you can experience when you do have a blood pressure. Some people know it so well that they could tell you that, they do get headaches. So if someone was okay and never did headache, never had headaches, all of a sudden they're getting recurrent headaches. If they don't have migraines or they don't have cluster headaches and other things like that, clearly you need to be looking at possibly the blood pressure going up. We've got what they call tension headaches, and that's one of them. You could get shortness of breath as a result of the blood pressure going up. You definitely can get nosebleeds. I've seen that a lot of times. And some people, when the blood pressure goes up, they get a bit of flushing. Those who are obviously of the Caucasian race, and some who are light-skinned and mixed race, they can experience the flushing. And most importantly, the dizziness. That is important. So people can actually tell you to a T what the blood pressure is like, because they say, I know my blood pressure has gone up because I can feel it in my head. My head's dizzy. I get a headache. So dizziness, if it's unusual, clearly you want to make sure you have that checked out, because it could be due to something else. Maybe anemia can cause it, and therefore you need to be assessed and checked and blood tests done to it to establish whether the dizziness is because of the blood pressure going up or because of something else. And clearly, if you do get chest pain, well, obviously, as we know, hypertension can cause narrowing of the blood vessels of the heart, the ones that surround the heart, which we call the coronary arteries, and that can give rise to angina, which is the chest pain. And if you don't treat the angina, it can lead to full-blown heart attack, which is obviously something you want to avoid. You could get blurred vision. You could get like a veil in front of the eyes. These are all changes that you need to look at. And most importantly, is the blood in the urine. I know most people, once they see blood in the urine, will rush to the emergency department, and rightly so, because we need to establish whether the blood in the urine is associated with pain or not. If it's pain, then perhaps it's the kidney stone. But if it's not, and it's painless blood in the urine, which we call hematuria, then clearly we need to look at the blood pressure, making sure that there's nothing else that is causing it. As we've just said, these are the parts that of the organs in the body that the blood pressure can affect. If you look at this, where the arrow is here, if I can get it, you can see what the narrowed blood vessel is like and what the normal blood vessel is like. Can you see the thickness of the wall and then the narrowness of the wall? There you can see that clearly. This is normal and that is abnormal, and that is why the blood pressure goes up. So obviously it gets narrowed because of the hormone, the angiotensin, and then it pushes the blood pressure up. So as I said, if it affects the brain, it can cause a stroke. If it affects the eyes, it can cause visual loss. It can cause acute blindness. If it affects the heart, it can cause a heart attack. If it affects the kidney, it can cause kidney failure and of course kidney disease, for which sometimes people will need dialysis. It can cause heart failure, And of course, of importance is the sexual dysfunction. So erectile dysfunction is a very common thing amongst people who are hypertensive and those who are diabetic as well. That is a very dangerous combination. That, again, just to sort of reiterate and strengthen what I'm trying to say, you can get strokes, you can get inflammation of the brain, encephalopathy, confusion, headache, and you can sometimes develop seizures if you do have the blood pressure going really high. And that can sometimes in effect affect the blood sugars, which will then give rise to diabetes. And as I say, it's a very dangerous combo, that diabetes and hypertension. Again, hypertensive retinopathy, the back of the eye becomes a little problem, i.e. sometimes it can get detached and that can cause visual loss, visual problems. If it affects the heart, it could get a heart attack. And of course, if it affects the muscle of the heart, it can cause cardiomyopathy, which can be acquired. And of course, that consequently leads to heart failure. Then, of course, the kidneys, as we've just said, can go into chronic failure, and sometimes we might need what's it called for that. Right, we've got an intruder. I don't know if you can see that. Anyway, someone's definitely intruding.
Hello, Doc.
Charles?
Yeah, we can hear you now.
Did you see, we've got a hacker, I think. I don't know, someone is interfering. I don't know if you look at the screen, the person is just trying to mess about.
Yeah.
Yeah, I don't know why that is.
Who could be doing this?
I don't know why they're doing this, but not very nice.
Not at
Anyway,
all.
We can throw, Charles, can we throw them out the room?
I don't know who's doing that.
I think
it's
I've just
disappointing
muted
that.
somebody called John. I think.
Yeah, well, I've thrown him out.
Yeah.
Charles, can you hear me?
We can hear you.
Yeah, it's not a problem. I think somebody is playing tricks and doing some.
Yeah, Doc, I've stopped the screen share, so you can continue. And then
I stopped it myself, right? No worries. Okay. I don't know if anyone can see.
No, I think you'd have to turn your camera on.
My camera, right? Okay. Right, it's on now. Can you see that?
Yeah.
Yeah?
Yeah.
Charles, can you see it? Can everybody see it?
We can see you.
Yeah, we can see you now.
Right, okay. Well, I'll probably try and continue then if I can.
Yeah. So
Apologies, everybody, about this. We'll just keep monitoring.
Right, okay.
So who are we looking out for?
Well, I'm not quite sure who's done this. There's a Jaden or something like that. The name was
Yeah,
written on the
well,
screen.
yeah, we've thrown them out.
Right. Okay.
Yeah.
So as I said, I talked about.
Doug, do you want to retry? Try sharing your screen again.
Okay. Well, let's see. What can I do now? Right. Okay. Is that all right? Can you see that?
No.
You can't. Okay. Well, I'm sharing now. I don't. It doesn't bode well, does it? Okay. Let's. You see that now?
Yeah.
Right. Okay. We'll go again. Right. So where were we? Yeah, we were, I think, here, if I'm not mistaken. Yeah?
Yes.
Right. Okay. So as I said, these are just the complications, the brain with the strokes, the encephalopathy, the confusion, the headache. Sometimes the blood pressure, when it goes high, can cause the sugars to go up as well, and leading to diabetes. And of course, with the eye, the back of the eye, the retina, which is where the images are interpreted, can become a problem. Therefore, the vision can be blurred, and sometimes people can lose their sight. And of course, the heart, angina, and that can lead to myocardial infarction and infarct or a heart attack. And the muscle can fail because of that. Therefore, it develops to what we call cardiomyopathy, and that can lead to heart failure. And the kidneys can shrink due to nephropathy, and of course, will then subsequently lead to dialysis. So if you obviously have tried everything to bring the blood pressure down and you can't, or you're not succeeding, then the GP can probably decide to put you on some medication. I don't want to go into those, but you may have heard of them, the ACE inhibitors, the angiotensin 2 receptors, the calcium channel blockers, nifedipine, the alpha-2 agonists, the losartan, candesartan, and all that. You can see them, beta blockers, bisoprolol. They can give you the water tablets, which are like bumetanide or furosemide. You can get those are medications that can help to maintain the blood pressure or lower it to an acceptable level. But of course, we can't go anywhere without talking about our home remedies. And most of the time, developing a healthy diet could be very, very vital. If you reduce the salt, because I see a lot of people going to the chippy, chippies buying fish and chips, which is what we have Friday, chippy tea night or whatever, and then they go get the fish, get the chips, and get the mushy peas, and then on top of that, they get the vinegar plus the uncooked salt. That's the worst thing you can do. So uncooked salt is the worst enemy you can ever think about in terms of the blood pressure. And we, as a race, are the ones that are very prone to this kind of thing. So clearly, fruits, more fruits, vegetables, whole grains, lean proteins like fish are definitely well recommended for people of our race in order to ensure that the blood pressure is maintained. As we've just talked, the healthy foods to your diet, you need to think about adjusting the average dinner plate. So instead of a lot of meaty portions, you could probably fill the plate with a lot more of the vegetables, the salad, and less of the meat. That is a very good balance to have. If you aim for, say, after 2 weeks, add 1 serving after a day, you definitely end up with 10 servings of fruits and vegetables a day. which is quite important to actually help in balancing the blood pressure. Again, this is a very good slide. As you can see, the blue and the green, the blue on top is obviously normal when you get to 120/80. When it gets to 140/90, it's elevated, and by the time it gets to 150/90, clearly it's now hypertension. So this is very important to remember. Those two figures, 140/90, that's what people really remember. 140/90 is what they're aiming for. So as it is, there are lifestyle changes that you could, develop or maybe adopt to lose or lower the blood pressure if you like. So if you start mobilizing, i.e. exercising, it doesn't have to be you have to be on the roads. That may be dangerous. You can do that in your backyard. You can do that around the block. No questions about that. Focus on your nutrition. As I said, cut the salt, and cut the carbs, and that would help you a lot in maintaining the blood pressure. If you are on medication, make sure you're compliant with them. Take them religiously. That is very important because the blood pressure has a very funny habit of catching up on you when you least expect it. And if you can, I think you can invest in one of these blood pressure monitoring gadgets that they have in pharmacies, maybe 20 quid, 30 quid, 40 quid. It would definitely help you. But remember, they're battery, if you like, controlled or generated. So if the battery is running low, you might get a false reading. That is important. These are just some of the pitfalls of using a gadget that is controlled electronically. The manual ones never go wrong, not unless the rubber bit can be chewed up or maybe losing air, therefore it wouldn't get it, the proper blood pressure. But in the main, if you sort of invest in a 30, 40 pound, 50 pound gadget, it should definitely serve you right. If you can, then concentrate on losing the weight. If you just lose, as I say, if you lose just 10 pounds of your weight, 10 pounds, not 10 kilos, just 10 pounds, because the kilo is 2.2 pounds. So if you lose just 10 pounds, that would make a difference. I'm not saying anything about you losing 20 kilograms. If you're a diabetic and you lose 20 kilograms, you would definitely be able to reverse the diabetes. So it's like if you're 100 kilograms in weight and you lose 20 kilograms, that's the 1/5 of your weight, and that would help you to maintain the blood sugars and, of course, the blood pressure. If you drink, make sure you drink in measures. There's a saying, he is pleasure, he that drinks in measures. So for the UK, I think it's 14 units for the females and 21 units for the male per week. If you could actually reduce that, or better still, knock it on the head totally, that'd be good. I don't drink, but if people want to drink, then at least drink in moderation. That would serve you better, and of course, the smoking, if you can't completely knock it on the head. There are agencies out there, there are gums, there are patches, there's hypnotherapy to help you cut out the smoking. And most importantly, try and distress. Try and sleep well. You can use relaxation, you can use yoga, you can use Tai Chi, you can use deep breathing. It's been known over the years, over the centuries, to actually help the blood pressure. Use your medication, you can get massage. That is really ideal for you. Now, I talked about the blood pressure being high in special circumstances. I wouldn't go deep into this, but it is something very important, especially for the Afro-Caribbean race, the Black race. This preeclampsia, those of us who have sisters, aunties, mothers of childbearing age, they may have heard of this. It is absolutely important because it can lead to fatality. It can lead to kidney functions being completely reduced to the point where they will need dialysis. So it's absolutely important that when someone's pregnant, they need to keep an eye on the blood pressure. Sometimes they can develop what we call preeclampsia, and that can lead to eclampsia, which will then lead to seizures. And even when the baby has been removed, I remember we had to deliver a baby in my emergency department because the mom's blood pressure was 220 over 130, and she started seizing. So we were able to deliver the baby immediately, and then kept the mom for a whole week on ITU because she continued seizing. It's very important to remember that, but I wouldn't go into this. Maybe we can dedicate a session, specifically or solely for this. Right. If you don't remember anything about this talk, please remember these 6 things I'm going to tell you about. Remember, if you don't know already, you need to know that high blood pressure is a silent killer. Most people have it, they do not know they have it until it's probably a bit too late. Sometimes they get to know they have it when they end up with a stroke or a heart attack or kidney failure. So remember that it is a silent killer and you need to take care of your blood pressure. Sometimes, as I say, you wouldn't know anything about it until you get a stroke. And thirdly, look at it, 14 million adults in the UK, 14 million adults. And we know the population, what, is it 60 million? That's like a quarter of the population do have blood pressure, high blood pressure, without knowing they have it. And as many as 5 million of these are undiagnosed. Can you imagine that? 5 million people are undiagnosed. And that is why it's important, because sometimes, as I say, they do not have any symptoms at all. And remember, it's all about the numbers. Think about it. As I'm telling you, 140, 90, 140, 90, that's the numbers you need to be keeping in your head. That's what you need to be aiming for. You know, exercise in order to reduce your risk of actually getting complications from your high blood pressure. It is important that if you get at least 150 minutes of exercise a week or physical activity, you are definitely on your way to success. No questions about that. And of course, if you binge drink or if you abuse the alcohol or misuse it, then please, 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 and please think about it and try and reverse that trend, because it will not serve you well in the end. So these are just the foodstuffs that you would need. You can see that raisins, bananas, dark chocolate, not the white one, alkaline water, the leaves that we use, you know, spinach, garlic, oranges, sunflower seeds, tomatoes, mangoes, Brussels sprouts. Now people don't like that, but lentils are quite good. Watermelon and, you know, hawthorn berries. These are all quite good. You could see that there's fish there as well. There's, you know, grains, fortified grains. These are all very good for the blood pressure. You know, the raspberries, the strawberries, and the blueberry muffins. They're all good. As you can see that pistachio is another one. Pomegranate is good for the hemoglobin as well. And beetroot is good for lowering the blood pressure, as we see. Salmon is quite good. You know, wild cabbage and collard. These are all very good. Now, as I said, it's a big topic. There's two parts to it, but I'll stop here. If you look at this heart-shaped slide, there's a lot of words we've used today, and I think they're all in there. But there's one particular word I'm interested in. If anybody can pick that out, I'd be really grateful, because that is what sometimes leads us as medics to go on a wild goose chase and then end up giving people medication when they do not need it. So I leave you to it. Think about it, but I thank you very much. And you can see the languages that I, you know, managed to have been able to speak. And you can see in Manchester, we say ta rather than the thank you, tenki, gracias, spasiba, shukran in Arabic, danke in Dutch or German, grazie mille in Italian, and merci in French. So over to you, and I'm open to any questions. Thank you very much.
Thanks a lot, Doc. So I'm just wondering if we can stop screen share, because we've got lots of questions for you.
Yeah, good. I like that.
Let's see. Great. Okay, so lots of questions in the chat box. The first one is from Hilaria. She says kidney disease is caused by uncontrolled blood pressure. So how does kidney disease cause secondary high blood pressure if it causes kidney disease in the first place?
Well, that's actually as a consequence of it. So if you maintain the blood pressure, yeah, if you maintain the blood pressure, then clearly that should not lead to the kidney disease we're talking about. But people who have got kidney disease and not aware they've got it, one of the signs of a kidney disease could be just the blood pressure going up. There's something called essential hypertension, which is the hypertension of the blood pressure, high blood pressure that we know we can't control. It's like, you know, there can be a cause for it. But kidney disease is definitely a secondary cause of hypertension. And if you got kidney disease, say, for example, you had a shrunken kidney and you weren't aware of it, but then you developed blood pressure, that's one of the things. That's why when you go to GP, if you saw the slide earlier on, it says urine sample. They will check the urine to see if there's protein. Again, for somebody who's got preeclampsia or eclampsia, one of the things we look for is protein in the urine. Someone who's got a kidney stone or kidney problems, the filtration of the urine or the blood that goes into the kidney and then comes out as urine which is what you don't need, if the filter is actually loose or very, very unhealthy, it can actually produce the blood in the urine, which tells us clearly there's something going on. But remember, the kidney produces what we call renin. So the Latin word for kidney is ren, and the hormone it produces renin. And the renin is what connects or combines with the other one, which is called angiotensin. And angio means blood vessel, tensin means tension. So renin, angiotensin, 1 becomes 2, and that pushes the blood pressure up. So in arrows, it's like a vicious circle. So the fact that the blood vessels in the kidneys are now narrowed because of the blood pressure, that leads to more elevation of the blood pressure. I don't know if I'm making any sense.
Ilaria, have you had your, has your question been answered?
Is she mute?
Hi, can you hear me?
Yeah, I can, yeah.
Okay, yes, yes. I didn't catch the first part because it was crackly, so
Right.
I didn't quite get that. Yeah, go on.
So in essence, what I'm saying is primary hypertension is one where we don't know what the cause is, it's just the genes we blame, yeah?
Okay.
Secondary hypertension is where there's something that has happened to the body that has led to the blood pressure going up. One of the causes of that is kidney disease. Now, as I say, if you do not know you have kidney disease, and yet you do have high blood pressure, one of the things the GP can do is actually check your urine. And if there is blood in the urine, or there is protein in the urine, especially in a pregnant woman, and the blood pressure going up, you think about preeclampsia, you think about kidney problems. So as it is, there is something called malignant hypertension. Now, malignant hypertension is mainly generated by the kidney. So if someone's got kidney problems, they have hypertension that is very difficult to control. And that is why sometimes you find in the Afro-Caribbean people, one blood pressure tablet does not work at all. It's ineffective. You normally would have 2 or 3 in order to maintain it. But if you can actually maintain the blood pressure very early on, you can actually either reverse it or maintain it at an acceptable normal, or level. If at all it goes higher, then clearly it needs to be brought down, because what it is, it becomes a vicious circle. The blood pressure sort of destroys the blood vessels. And as we know, the blood goes into the kidney for it to be filtered, for the blood to go back up, and then the urine, which is the waste product, comes out from the kidney to the outside. So if you have a vicious circle where the blood vessels are narrowed, and of course the renin, which is produced by the kidney. So the kidney in Latin is ren, and the substance or the hormone it produces is called renin. And that combines with another hormone in the blood, which is angiotensin. Angio means blood vessel, and tensin means the tension. So the tension in the blood vessel combines with the renin, and it becomes renin-angiotensin, which is 1. And that becomes 2, and that gives the blood pressure, impetus to go higher.
Okay. The reason I was asking, it's because I am an ambassador for organ donation. I'm a kidney disease and transplant patient, actually. And mine started, I got into kidney disease suddenly through a miscarriage at 22 weeks.
I'm sorry about that.
Oh, it's okay. It's fine. I'm okay with that now. That is why I campaign for organ donation, and I talk to a lot of kidney disease patients, supporting them with the different government departments in the UK. And one of the questions I usually have to answer is what causes kidney disease. Now, as an ambassador, we are trained on, giving talks and stuff like that. And one of the things that we've been told, which you just mentioned, is uncontrolled high blood pressure. So that was why I asked the question. If uncontrolled high blood pressure causes kidney disease, how can kidney disease cause secondary kidney disease cause secondary high blood pressure? That was the reason I asked the question, because what we have is peripheral. I'm not a doctor, my husband is, but he's more of orthopedics than your specialty.
Yeah.
So that's the reason I'm asking. So now you've explained it, it actually make more sense to me.
Right.
And if I can have a copy of your slides, when I'm talking, I'll be talking from an informed angle, actually.
By all means, yes. I
Yeah.
mean, I think Charles could be the mediator for that. That's no problem. If anybody wants the slides, we can make them available. That's no problem.
Okay, great. Thank
But
you.
I'm glad at least you have a better understanding as to the
Yes, I do.
the narrative
Yes.
and how it functions. It's a vicious circle, actually. I'll be honest with you. It's a vicious circle.
Yes.
Because the blood
Yes.
vessels get destroyed, and then in effect, in turn, then actually leads to the blood pressure being going up and cannot be controlled, and therefore you need to control that. And that's why it's important to contain it at the very beginning before it actually starts damaging the vessel.
Yeah. Thank you very much.
Thank you.
Doc, there's another question here.
Yeah.
Asking if there is genetic difference between Black and white people that causes Black people to have a higher rate of hypertension, or do you think it's just about environmental factors such as stress?
Oh no, far from that. As I said, the genetic factor is quite, high there in play. There's no question about that. For some reason, we have the Afro-Caribbean race. We are prone to that kind of thing. Why? Don't ask me. I can tell you that people who live in those, so to speak, third world countries, the portions of meals, the kind of food they eat, the quality of the food they eat, the fact that they don't have the luxury of us, sitting in the office and controlling my washing machine from home, not wanting to move, sedentary lifestyle and all that. The kind of meat we eat, people in Africa sometimes will pray, this is a very crude joke, will pray for someone to die so at least they'll be able to eat some meat at the gathering, 6 months they might have that. What they have is fish, maybe, plant protein. So that, they move out, they don't have the cars, they don't have the trains, they don't have the trams, they don't have any of those. They move out, they burn the calories, and they look at it, and somehow that feeds itself up. We come to this part of the world, we obviously put on the weight, we put on high, the cholesterol goes up because of the kind of food, and all of that combined with the genes clearly doesn't help. But as I say, because of the genetic factor, by the time you get to 60, 70, the blood pressures are creeping up. And that is why it's important to remember these screening checks are absolutely vital. So if the GP contacts you like we do for breast screening, the first thing we really see for someone who's had breast cancer, for bowel cancer at the age of 60. Yeah, these are all absolutely vital. The Afro-Caribbean race for things like prostate problems by the time you're 40, checking the eyes by the time you're 40, because glaucoma is quite right, prostate problems is quite right, so fertility. I can go on and go on. There's so many problems. But obviously the Caucasian counterparts do have their own as well. Because clearly things like colonic cancer is very rare. Things like breast cancer is very rare in the African. So there's a lot more we can talk about the differences. But clearly genes have a big role to play in the blood pressure.
Okay, thanks, Doc. Yeah. So there is another question. I know Heritage, you've raised your hand, so I'm going to unmute you, then you can ask your question.
Thank you so much, Doctor. I really appreciate that. That was very informative. Yeah, basically, I have heard about a product called Juice Plus, and the product is made with 100% fruits and vegetables, and it's all plant-based. And a friend of mine have used this product from the US, and then he stopped it when he started on the product. He stopped his normal medication for high blood pressure, and under 4 weeks that he started using this product, he told me that the high blood pressure used to be 180, 110. But then the high blood pressure went from there to 125/80. And he was really, really surprised that kind of like the product really works. I just want to know the major impact of fruits and vegetables on high blood pressure. I know you've talked about it. I just want to know the percentage of, the impact, how it can impact one's health, especially those with high blood pressure.
Well, there's no doubt that a change in lifestyle is very, very essential for control of the blood pressure and for management of the blood pressure going forward. There's no questions about that. I mean, let's say we're all told, it's something we've all learned from being children, that, vegetables, the 5 that we hear about now, we're talking about 10. It's important to bear in mind that these are things that would help us in the long run. As we grow older, the population is getting older, it's aging, and as you age, that's how the comorbidities come about. And therefore, the earlier you actually get those managed, the better it is for you. And I can't say more than that, because clearly the vegetables are important, because they're all plant. And normally it's the animal protein, the animal fat that leads to high cholesterol, that leads to the blood pressure, that leads to the diabetes and things like that. So if you actually do more of plant fat or plant protein, then clearly you're onto a winner, especially when you're giving chance to the bowels to actually decongest themselves, detoxify themselves. That definitely helps you. There's no question about that.
Thank you so much, Doctor. Could we have the recordings of this this Zoom, please?
By all means, I leave you in the capable hands of the maestro, Charles.
Thank you. I have already popped in my emails. Thank you so much, Doctor. Thank you.
You're welcome.
That's okay, Heritage. We'll be in touch.
Thank you.
All right. So, Doc, there's another question asking. So if an eye consultant tells you to go and get your blood pressure checked, is there something to be worried about?
See, this is why we went a bit too, what's the word for it, quickly. The heart-shaped slide that I actually was talking about? There's a word there, but actually you just alluded to that word, and most people find it out. Sadly, maybe people could not do it because they couldn't get it. But there's something that we're all aware of, the white coat syndrome. I don't know if anybody knows why this is called white coat. Nowadays, you hardly see a doctor who wears a white coat, because, environmental health and all that, they really will clamp down on that, because they find out that the contamination is just absolutely, we used to wear ties and suits and the white coat on top of it. And they found out that the tie that you're wearing is so full of bugs, it's teeming with bugs, you won't believe it. So obviously, to avoid that happening, they took it off. And now everybody has got scrubs, especially in this COVID-19 period, or if you like, epidemic. Everybody, whether you're an orthopedic surgeon or you're an A&E surgeon, you definitely will wear the scrubs because of a reason. Now, it's important that when you go to the doctor, that white coat syndrome would probably cause your blood pressure, which was probably at 80 or 100, to go up to 150, because you're now concerned that what you're going to be told is bad news. So there is something called the fight and flight hormone, which is adrenaline. The moment you step in or make your mind up, I'm going to the GPs, straight away, that kicks into action. Oh my God, what am I going to be told? And without you knowing it, you get to the GP and your BP, which is normally 120, gets to be like 180 because you're concerned. So if someone calls you to the GP practice and then they find out that your BP is gone sky high, you're advised as a GP or as a medical practitioner not to take that as the correct reading. So sometimes they have to measure it 3 times in the space of 10, 15 minutes. But imagine you go to the GP and you're allowed 10 minutes. Usually, when you walk, the blood pressure will go up. The blood pressure will be at best measured when you just wake up. That is at its lowest. And that's why sometimes you're well advised to do your monitoring at home. So you're giving the blood pressure cuff, you put it on your arm, and that would be measuring it all day long, and you carry on doing your activities. Then they will take that and they will read it and then get an average. And from that average, they can tell whether your blood pressure is on the high side or borderline or low. And if it's obviously borderline or high, then they will have to probably consider either changing your lifestyle, or maybe putting you on some therapy like medication to try and maintain it. So I don't know whether that answers the question, but clearly that white coat syndrome has a big role to play in the...
Yeah, no, it wasn't that. I went along to the hospital to go and see the eye consultant, and they did all these screens and scans and everything. And then when we were actually talking, she said, at the back of the eye, I can see something. So what is your blood pressure like normally? And I said, oh, it's normally okay. She said, oh, well, I think I would go along and have it checked, because from what I can see. And I just wondered, or what would she see at the back of the eye that would make her think I need to go along to the doctor and have it checked?
All right, okay. I think well, the question is now clearer. It wasn't clear at all. If you told me that, I think I will actually refer you to the slide. There's a slide I mentioned retinopathy, which means,
yeah.
yeah, so retinopathy, when the the optician or whoever is looking at your eye, they dilate the pupil, that black bit, or the color of the eye, that black hole, which people don't know is a hole, yeah? So they dilate it so they'll be able to look at the back of the eye. Now, there are certain images that would tell you that this person is hypertensive or not, because you could actually tell from the way the blood vessels are. They call it nipping. Sometimes you can get some bleeding into that, but only the person who's looking at that microscope will be able to see it. And that, I think, is why they're asking you, hang on, I know you say your blood pressure is fine, but judging from what I see, I think I'll beg to differ. Therefore, probably you need to be seeing your GP. And it's true, because a lot of people will treat the figures. They'll treat what, like, for example, someone comes to me and they say the blood pressure is 120/80, but they've not been taking their medication because they think it's fine. And now it's crept up for the past 7 months. They've not known about it because they don't have any symptoms. Remember, it's a silent killer. You might not have the symptoms. Therefore, if you go a year later and I look at the back of your eye and I think, I'm going, ooh, what's your blood pressure like? And you tell me, oh, it's controlled, then definitely what I see now is what I have to treat. And from what I see, if your eye is actually telling me you've got retinopathy, and God forbid you have diabetes on top of that, then clearly you need to be making some quick steps towards getting that controlled.
Right. Oh, thank you.
Thank you.
Thanks, Doc. Yeah, also there's a question, is it worth people buying their own blood pressure monitor? And if high, is it worth, doing that over, 3 minutes? I mean, 3 times over 3 minutes. Oh,
No.
sorry, over 10 minutes, just as you've mentioned.
Yeah, as I say, it's a good thing to have your own blood monitoring device. It's really good. Like I say, the cheaper it is, the less likely for it to be reliable. People say penny wise and pound foolish. So if you buy one for $5 or $10, you might get the wrong reading. But if you definitely invest in one, I think 30, 40 quid will be a decent one, really. But you need to do it twice a day. So you do it for a whole week, for example, first thing in the morning. As I said, the blood pressure is at its lowest when you just wake up. In the very early hours of the morning, that's when it's good to measure it. And then it peaks at around midday. So imagine you have a GP appointment at 5 o'clock or 6 o'clock, and the blood pressure would have gone so high that when they go and read it, it's actually reading very high, when in actual fact, it shouldn't be that way. Plus, add to that the white coat syndrome. Everybody's concerned. You see the white coat, oh my God, that's it, the doc. You see what I mean? So these are all factors in play, and therefore, they tell you when you're measuring it, you should be measuring it 10 minutes apart. But when you go to the GP, the maximum time they're giving is 10, 15 minutes. By the time they get the history, they don't get around to doing it properly. So clearly you get the false reading, and that's why it's important to have your own. If you can go to the GP with the recording of your blood pressure over the week, and it's actually 130/80 or 140/90 for the whole week, or maybe less than that or in between, and the average is 130/90, well, they'll tell you you're doing well, continue doing what you're doing. Because as I say, you have control of your body. But by the time you get to the GP and you've not measured it, and you go there late in the evening or late in the afternoon, and of course you're worried, you're concerned, clearly you're not going to get a true reading, and you might end up being given medication when in actual fact you don't need it. I don't know if that answers the question.
It does, thank you.
Right.
Great. So, Doc, there's another question about whether lack of sleep, affects our blood pressure.
Oh, you don't need me to answer that. Just imagine. I attended a conference in Liverpool, and I remember that the lady who was the key speaker had a talk on the business of sleep. That's the title, The Business of Sleep. And I tell you what, when she started, by the time she finished, there were 200 of us, all doctors, consultants here and there, and all the professors. Everybody was turning and looking at each other and thinking, that definitely is us, without a doubt. So sleeping is very important. There are people say 8 hours a day. Now, that is not essentially true, because there's the 3 types of sleep. I don't want to go into that now, but the REM sleep is the most important one. So if you can get a good 1 hour sleep, yeah, that would actually take away the fatigue and all that. That might be what you need at that time. That is why, if you notice, in the countries like, you know, Spain, Italy, they're very, very fussy about the afternoon siesta, what they call power nap. That 1 hour between 2 and 3, 2 and 4, clearly it helps a lot, you know. But the human body has got what we call a circadian rhythm, which means the rhythm at night and the rhythm in the morning. Now, if you work nights, your body clock becomes completely different to somebody who works at, you know, days. And that determines your blood pressure. If you imagine that, if you work at night, you eat definitely the wrong things, your eating habits become wrong. And the next thing you realize, you're putting on the weight, you don't even know you're doing it. I can see heads nodding, and I know people are resonating. This is resonating with people. You know, that's the kind of thing. That's what sleep does. So the business of sleep actually has a major role to play in the 5 leading killers, diseases in the world. 5 of them, there's 3 to do with the lack of sleep. One of the risk factors is definitely lack of sleep. So if you don't sleep, imagine you're like a zombie. And then it goes into overdrive. And then the adrenaline gives rise to more of the angiotensin, and then the blood pressure cannot come down. And imagine it's doing that on a daily basis. Clearly, by the time you do it over 5, 10 years, the body will start tiring, and then obviously becomes a norm for you. That becomes a dangerous thing. So sleep is definitely a big risk factor in maintaining the blood pressure.
Thanks, Doc. Whilst you're on that, you know, apologies because of the interruption, we've run over, but, you know, it might be that probably the whole month of, you know, November, depending on your schedules, would have a couple of sessions, you know, with you.
As long as I'm given enough time, I don't have a problem. But I'm happy to deliver the stocks. It's important that.
Thanks, Doc. I mean, whilst, you know, you're on sleep, I mean, someone is asking, you know, is our blood pressure supposed to dip during times when we sleep? And there have been some studies that show that Black people's blood pressure don't dip during sleep. Do you know why? And how do we get to know our blood pressure at night during sleep?
But I say, I don't think it's essentially true that the blood pressure doesn't dip at night when you're asleep. Definitely when you're asleep and you're relaxed, you know, there are hormones that control the sleep. There is dopamine, there's melatonin, there's cortisol, and all. These are all, you know, happy hormones that help in bringing down the blood pressure. So if anybody tells you that the man's blood pressure does not when they're sleeping, I think it's not essentially true. Everybody who rests, I mean, imagine you're resting, clearly the blood pressure. How do you think you go on holidays? Whether you're black, white, or gray, or orange, or brown, when you go on holidays, you don't have the pressure, you don't have the stress of work, you don't have to care. You know, I feel that people go, they start, you know, using the alcohol, is full water and all that, and then instead of drinking 1, they drink 10 and all that because it's all free. That's a different thing. That's a different monster, completely different. But the fact is, you're resting. You don't wake up to 5 o'clock, you know, you're resting. Clearly that takes its toll on the blood pressure. It will dip. Whether you're black, white, or orange, clearly the blood pressure will go down when you sleep. The problem is, a professor in London found out that when a black or Afro-Caribbean person is found to be hypertensive, the hypertension does not readily lend itself to therapy already in a single fashion. Therefore, if you notice, the Afro-Caribbean people who are hypertensive will be on 2 or 3 tablets, because that's the way you can control it. And perhaps we have this kind of discipline of not attending GPs when they are worried, as we were asking the question earlier. Therefore, these things could have been nipped in the bud, so to speak, maybe it could have been caught in the early stages. Yeah. Someone who's 40 should have a blood pressure of 160 over 90. No, someone who's younger should have that blood pressure. So it is happening. It needs to be thought, it needs to be stalled, it needs to be cut right there in its tracks. And the way of doing this by an investigation carried out. And that way, you address it in time, and you will definitely get some benefit from it. But to say the Afro-Caribbeans' blood pressure does not dip when they sleep, that is not essentially true. I disagree with that.
Okay, Doc. I have a few more questions for you. So I'm going to unmute Judith and then you can ask your question.
Judith had to leave.
Okay, all right, okay. Right, so I'll bring in Dominique then. Dominique?
Yes, hi, can you hear me now?
Yes, we can hear you now.
Oh, thank you. Thank you so much, Doctor. Thank you. It's quite amazing. There's so many things that you've said that resonate particularly with me. Having young kids and actually being a walking zombie, which as many moms are, it's absolutely not easy to actually sleep, which I know is one of the major cause of high blood pressure, which you've mentioned. The question I'm having is a bit personal. I don't know if I'm hoping that it will also resonate to other parents. I've been to the doctors a couple of times with being dizzy, and sometimes dizzy to the point where you actually lose, you kind of have a blurriness in your vision. But I've been tested somehow, like try to replicate, especially when you bend down and you try to pick up something and stay at a very low level and wake up to see, you know, maybe is that the cause of it, to be able to see if you have some sort of balance or imbalance issue. But it's still, my blood pressure came back to be normal, but it still doesn't stop the dizziness that I get sometimes. I'm just wondering if it, I mean, I'm hoping to get the monitor to be able to get the blood pressure apparel home. That probably will help to be able to say exactly when that happens and, you know, which period could that probably be the cause. But I'm just wondering what's the next step to do, because if it doesn't show that there is any high blood pressure at that moment, you know, what will be your advice to be able to do that? I'm probably sure it might be the fact that it could be just a lot of fatigue, but I just want to know what your thoughts are around that, because I'm sure there are a lot of moms that kind of go through that, especially when they're extremely tired.
It's a very good question, and thank you for that. Now, I don't even know how I can actually narrow it, but it's a multifaceted answer or response, if you like, because this is not something you can just answer straightforward. The reason why I say that is you may well have actually hit the bull between the eyes by saying fatigue, but fatigue is an abstract saying, is an abstract understanding. As I say, you could be on medication that may well be reducing the blood pressure. That's one thing. You could be anemic. Now, anemia can give rise to dizziness, as I said earlier on. Sometimes people don't know about it. Now, the Afro-Caribbean race is prone to fibroids, and the fibroids do one thing. They make you lose a lot on the monthly period, yeah? We call them the physiological contraceptive pill, because when you have fibroids, the possibility of getting pregnant is lowered. And when you do get pregnant, the possibility of miscarrying gets high, because the fibroids, like the baby, are all in competition for the hormone that is there, which is the progesterone. So it gets bigger, like the baby gets bigger. And so there is this battle going on between them all the time to see which one fits into that small volume, that small vacuum, which is called the amniotic sac. And the womb will then expand up to 40 times the normal size by the time it gets to labor, if you get to that. This is why a lot of women find it difficult. So one thing it does is it messes up the cycles, you know, the hormonal cycle, and therefore leads to what we call menorrhagia, where if you are losing blood maybe 4 or 5 days at a time, now you'll be losing blood 2 weeks, you know, and sometimes you do get clots with that. So the more you lose and the less you make, the more likely you are to develop anemia. And that would result in that fatigue. That would result in, you know, shortness of breath, you know, the nails being very brittle, the hair falling off. You feel tired all the time. You get tired easily. You go up the stairs, you have to be out of puff. You'll be there and all that, you know, all of that. So it's not just a symptom on its own to say dizziness, because what else can lead to dizziness is probably an infection of the ear. So what we call labyrinthitis, sometimes vertigo. So there's a whole medical book, if you like, on just dizziness. I'll tell you that. So what I'd advise if you have got the symptoms is probably get to be investigated in order to get to the bottom of it, because a bit more of characterizing the symptoms might lead to something that you might just have overlooked. But as I say, sometimes the medication we give to our patients gives rise to that. And it may well be a case of just the exhaustion, being a mother. If you have 2, 3, and you have to be on the go, you have to prepare them, you have to bathe them, you have to do this and that. And you get tired, perhaps you don't get the support from the other half and the rest of it. And then on top of that, you have to then work yourself. So obviously, you're on the go all the time, you don't have time to rest, and obviously that dips on the immune system, and that causes problems. So I think you need to be probably, further investigated to make sure that there's nothing there that would be causing this problem to be persistent, really. Is that okay? Or maybe I'm not particularly answered your question, but just a few tips there as to how you approach it.
Does any come back, Dominique? Okay, I think two more. Well, I mean, there are a few more. My blood pressure has been 213/95 in the past, and I was unaware. And this person is saying, I'm taking more fruits, veg, and exercise, and it's reduced. Cooking own food, no salt has also helped. And so she's asking, is it possible that your blood pressure can can show 140/85 regularly? And is that acceptable to, an individual? I mean,
I'll take the tail end first before I answer. Now, the blood pressure, I think somebody asked me that question some time ago. The blood pressure obviously goes up and down. Someone said, well, every time I measure my blood pressure, it's never the same. That's true, because clearly certain things make the blood pressure go up and certain things make the blood pressure come down. Usually, the blood pressure will go up. If you drink a cup of coffee, I mean, I don't know if you know about cola nuts. Charles might know that. Yeah, the cola nut in Africa, that's where they've actually derived the Coca-Cola. Yeah, that's where they got it from. So Coca-Cola is from cola nut. And I tell you what, the cola nut is what we used to use. We chew it and it's got so much caffeine in it, and we need to use it because the eyes just go ping. We study all night long, burn the midnight light, as it were. That's what we used to do. But I tell you what, the blood pressure after you take some of the cola nut will go up, but it's called transiently. It goes up and then comes down. Same as, for example, if you eat any food now that has got carbohydrates in it, the insulin, which you produce, will bring it down later, but initially it will go up. So if someone who's diabetic, I'm just giving an example. Someone is diabetic and then they go to me and they say the blood pressure, my normal blood sugar is 10, and now I find out it's 20. One of the things I find out is, have you eaten anything? And they tell me, oh, I've just had a bar of chocolate. Well, that's the answer, because it goes up. But then in someone who's got a healthy pancreas, the insulin is produced, so it mops it up and brings it down. Same as the blood pressure. It will go up if you actually, were in front of a snake or in front of a bulldog that is actually rushing to come at you. The blood pressure will go up, no questions. If I measured it now, it might be in 180, 190. But the moment that dog is taken away, or that snake is taken away, it should come down. If it keeps going up and not coming down, that's a sign to tell you that something is not right, and therefore it needs further investigation.
Thanks, Doc. There's a question here, if there's a link between high cholesterol and high blood pressure.
Oh, yes. That's the short answer. And that is something you pray does not happen. The problem is the cholesterol, again, has a funny habit of creeping up on you. As I said, the kind of lifestyle, the food, the animal products we eat, because cholesterol is an animal product, and we as human beings, we are animals as well. We produce our own endogenic, if that's the word, if you like, the one that we have naturally. We produce our own cholesterol naturally. And if we then eat extra or external cholesterol from the meat that we eat, like the beef, the chicken and things like that, over the years, it creeps up on us. And that's why, as I say, the same as the blood pressure. As you grow older, the kidneys begin to lose the moisture that they have, the water they have, and therefore the blood pressure goes up. So if you have that and you don't know about it, and this is normally how it presents, then clearly you need to be paying more attention. And that is why the Well Man Clinic, I advise you to attend. The Well Woman Clinic, I know the women are very good at that, they attend it. But that's when you get this thing checked out. Because if you can arrest it at the very early stage, you will be able to treat it successfully. No question about that.
Thanks, Doc. There's a question here. Does a diet rich in poultry have as adverse an effect as red meat?
Say again, I didn't get that.
So a diet rich in poultry, is that?
Right, in chicken and things like that.
Yeah, chicken, poultry in comparison to red meat. So this person wants to know if you have, high, rich,
I mean, if you ask me what science would prefer, clearly would prefer the chicken. In fact, ostrich is the best because it has the leanest meat, but it's very expensive, So if you have to choose between red meat and white meat, I'd say go for the chicken as opposed to the meat. I'm not saying don't eat the red meat. Don't get me wrong. You can eat that because you need the protein, you need the hemoglobin, you need the iron, you need the calcium it provides and all that. However, eat it in less quantity in moderation, But as I say, us Africans, especially in the West where I'm from, if you have a wife that cooks a meal and there's not 5, 6, 7 creatures, man, that wife is in trouble. but that's the thing. It's important to remember the white meat is definitely less of a threat compared to the red meat. That's the short answer.
Great. So questions, further questions for you. Are there any foods that contribute to growth of fibroids?
Fruits?
No, are there any foods?
Not that I'm aware of. The only food that contributes to the growth of the fibroid is the hormone. And that is something the woman produces, the progesterone. As I say, the baby competes with the fibroid for that substance because that's what they thrive on. Some people will have it, it's very, very small and they don't know they have it. Sometimes it's actually when they come to us and they've fractured the hip and then we look at the pelvis and I ask my juniors, what is that? And they tell me, oh, I don't know what that is. I say, hang on, this is where the bladder is. What's in the bladder in a woman in that same region? And they don't know. And I tell them, well, that's what a fibroid looks at when it's calcified. So they may have it, they don't know about it. But yet, if it gets bigger and it causes problems with fertility or conception and all that, clearly, once you conceive, it becomes a problem. Before conception, it becomes a problem to conceive. So either way, but if you actually can manage and get your family without needing to have it removed or have it shrunk, then sometimes people die with it, not even knowing they have it. But I don't think there's any other food that we eat that would actually contribute to that. People might have their own home remedies and all that, but I went to medical school and I can't subscribe to that kind of thing. I'm sorry.
Right. Okay. So there's a question here if there's any treatment for, young person. I'm wondering if that's in relation to high blood pressure.
As I said, that white coat syndrome is a big thing. If you have somebody who's young, maybe a 30-year-old, under 40, having bouts of dizziness, tiredness, fatigue, chest pain, weeing a lot, drinking a lot, and all that, bleeding from the gums and rest of it and things like that, clearly they need investigation. It doesn't necessarily, this is it, I want people to understand, it doesn't mean because you're going to the GP or coming to hospital, it means you'll be started on treatment straight away. In fact, if someone is an established hypertensive, i.e. someone who's got a high blood pressure, and they come to us and the blood pressure is raised, most of the time, we don't do anything at all. As long as there are no symptoms, i.e. neurological symptoms, where they have symptoms of a stroke or a heart attack or a kidney failure, or blindness or anything. If they don't have any weakness, any pins and needles or tingling or numbness or speech deficit or defect and all that, clearly we tend to just observe them and make sure if they haven't taken the tablets, we give them there and make sure it's coming down. But blood pressure is not something you want to just bring down straight away. It's a gradual process. So if you have somebody who is under 40, who definitely has got a blood pressure that is raised, it needs further investigation. I cannot stress it enough, because if you catch it in good time, there is a good possibility that you could actually stop it in its tracks.
Thanks, Doc. There's another question here. I know you have your specialty, but there's a question about whether there's any treatment for a young woman who has fibroids, who's been offered hysterectomy.
Who's been offered, sorry?
Who's been offered here, hysterectomy.
Hysterectomy,
Yeah.
right, okay. Sorry, do we have an age for this woman?
Well, I've been told she's a young woman.
All right, okay, young, well, I'm 60 and I consider myself young, for example. But no, as I say, this is something you need to take into context. Now, I have seen somebody as young as 27 lose their womb. Now, you might say, oh my God, that is so cruel. But the fact of the matter is, if we hadn't done it at the time, that
She's 36.
Right, good. So 36, now you're getting, in fact, this is what I talked about. I gave you the option of menopause. This is perimenopause. I gave you the option of either hypertension or menopause, and we chose the hypertension. But I just did a talk in my community about menopause, and that obviously was well received. But by the time you get to 36, you're looking at perimenopause setting in. And therefore, if you have had your family completed, I repeat, if you've had your family completed and the bleeding is that bad that is causing you some undesirable side effects, like for example, you're becoming anemic and the anemia is not lending itself readily to any remedy, any therapy, because it's like a what's the word for it? It's like a supply and demand kind of thing. So if you're losing 2 pints, for example, in the 14 days that you've had this period, and yet in 4 weeks, you can only make 1 pint in the body, then obviously you're on a way to being in negative equity. If you are a house owner, as you know, the next thing you realize, you're going for foreclosure or they will send you to court. The reason why I say that, it's a simple analogy, because if the amount you produce, the amount of blood you produce is not equal to the amount you're losing, i.e. what you produce is less than what you're losing, clearly you're on a negative trend. And therefore you will have all those businesses of high blood pressure or low blood pressure, dizziness, weakness, lethargy, tiredness, you name it. Yeah? So therefore, they would actually look at the benefits versus the risks. They can't take a decision without you being on board. They would actually suggest to you that we can give you hormones, like for example, the pill to probably stop the blood. They can give you tranexamic acid, which can help in controlling the bleeding. They can give you norethistérone, which is a hormone, which you can take 3 times a day. That would help to control the hormones as well. But if all of that is not helping and you have had your family, the best thing for you is to decide whether you want to continue bleeding or whether you need to actually see to this once and for all. The other option you would have is probably they could actually send, right, they sort of introduce a bead through the groin into the blood vessel that supplies the fibroid. So that blocks it. And when it blocks it, it causes it to shrink because it's not getting the food that is, depending on from the blood. So when the fibroid shrinks, then obviously you would have less symptoms. That's another one. But clearly the GP can see you and would go through the treatment modalities that you have. The fact that they are suggesting a hysterectomy, that may well be the final straw. It's like the last bit. The only time that would come to a fore is when they know that this person is on the verge of losing their life, and therefore they need to definitely act quickly. The other thing it may be an option is because they've seen that maybe there's some, abnormal cells in the ovaries, not in the ovaries, in the cervix or in the vagina, and now they want to do a hysterectomy, they might save the ovaries for you, which are the ones that have the eggs. So they can take the eggs and freeze them. And then for a later time, when you find somebody, that egg can be used to, produce a child for you. That's another option they have. But they will not take that decision of actually offering a hysterectomy lightly. I can tell you that. If you have any doubts about that, then clearly seek a second opinion. That's my advice to you.
Thanks, Doc. Yeah, and from the chat box, we have a session planned, on gynecology and stuff. So we'll pick that up. I think, yeah, I'm going to bring in Dominique, and then there's one more question, and we can wrap up. But definitely, we're going to have you back for a few more, conservative weekends. So
Anytime.
Dominique, you want to ask your question, and then I'll go to the one about kidneys.
Yeah, thank you, Doctor. Thank you, Charles. Doctor, sorry, I just had I couldn't unmute myself for technical reasons, sorry. I just wanted to, first of all, I think you've answered most of the questions when we discuss about all my symptoms and stuff. I think what I want to ask, first of all, is what would you advise someone in this kind of situation whereby they've gone through some of these tests and they still say they don't have any high blood pressure, but they still have the same symptoms? That's one. The other question will be, how do you tend then to manage those symptoms if if the results comes back that there is actually nothing underlying? Because you've mentioned that exactly with having to manage your household, having to manage all the other areas of your life to be able to maintain a healthy, balanced life. What will be the main advice that you would give? Maybe I'm speaking from a working mom with younger kids. What would you advise parents in this kind of situation?
I'm not sure what has been done in terms of investigation, in terms of therapy that they would, I mean, the GP or anybody else would have suggested. I don't know, because that is a bit unclear to me. But usually on the investigation, clearly there gets to be something like a focus, like a factor there that may well be causing this. And as I said, things in medicine, sometimes you might think they're straightforward. They might be so complex, so much of a red herring and sometimes a wild goose chase. And it might be something, a 1 in a million thing that maybe the person who's dealing with you has never seen or dealt with. Therefore, there is this thing they call multi-disciplinary team assessment. So if, for example, they've checked the ears and they found out the ears aren't responsible, they've checked the blood, they've found out it's not responsible, and they've done maybe a scan of your head and they found there's nothing there, then perhaps what they will need is find out whether giving you something would actually get the blood pressure to rise, or whether they call something they call empiric treatment. So for example, somebody who's got dizziness and no other sign of vertigo, you might decide, well, okay, talk to the patient and say, we don't know what is happening here. We have no idea. We've done this, this, and this. But as part of the remedy, this is something we suggest we trial. So it's like a trial and error thing. And that is quite okay, as long as it's not causing any deleterious side effects to the patient. You could do that. Now, for example, somebody who's 65 and above nowadays, and they've got problems down below, i.e. they're going to wee a lot. And when they go to wee, it gets a bit of a sting, or maybe it's painful, or maybe there's a whiff of ammonia, maybe a bit of a smelly, fishy smell. Then clearly nowadays, we don't use the urine. We used to dip the urine, and people were so pedantic about it that only if the urine shows this, that they can treat it. Nowadays, the guidelines are clear. If the person has got symptoms that are similar to someone with a water infection, then you can treat them empirically, i.e. give them the antibiotics. Simple as that. So that can be something you can do in this particular scenario where nothing has been found. It may well be just the exhaustion of being a mother and juggling work and juggling being a wife as well. So all of these things would have a toll on you. Perhaps a holiday, perhaps something to take your mind off might be something that would help. But other than that, I don't think there's much more one can suggest. But I'm sure if you have a thorough investigation, there may well be something that you've overlooked that could just be found, and that may well be the cause of what you're feeling the symptoms are.
Thank you, Doctor, for that.
Right. It's good, Doc. You can prescribe holidays, that'd be good, to get that for free. Well, I mean, there's one more question. If you've had operations for kidney disease and that has decreased your kidney function, do you have to have your kidney removed?
That's a bit confusing.
You've had operations for kidney disease,
right?
That has decreased your kidney function.
Yeah.
So in going forward, do you need to have the kidney removed?
That's a bit of a question that is very, very unclear. the operation you had on the kidney was for what? Was it like a kidney stone that, you know, was too big that it can't be removed, or what? Because if you're saying you had surgery on the kidney and the kidney function has gone down, there's one principle that I apply in my practice, is that half a loaf is better than none at all. So if you have a kidney that is functioning at 50%, you're better off having it than having to have dialysis, yeah, than to have the kidney removed. Remember, I have seen people donate their kidneys to their loved ones. So if you lose one kidney, the other one will come in handy. If you lose both, then clearly you need to get the urine made from the blood, and therefore you need dialysis. And the fact that you have the kidney removed does not mean that the kidney is probably, you know, tumorous or something. It may well be that it's shrunken to the extent where it's not functioning properly, and therefore there's no point in having it. You might as well have, you know, dialysis. But the removal of the kidney mainly is because it's either shrunken and causing problems, or it's inflamed, or it's got some, you know, some tumor in it that maybe is causing that, and therefore it needs to be removed. But these are all questions that would be answered via either the urologist or the nephrologist, who the GP can refer you to directly. No problem at all.
So Lorna, has that answered your question? I've unmuted you. If you...
Yeah, thanks for unmuting me. Thank you, doctor. Yeah, my kidney was swollen, so it was inflamed, or it is, I think it still is. I think I've had 2 nephrostomies. I had to have a nephrostomy bag for quite a while, which I wore. Well, when I say quite a while, I think it was a good 6 months that I wore it for. And when they showed me the x-rays, my left kidney, which I know has a function of about 28% or something, was swollen. But I didn't want another operation to have it removed, so that's why I was asking the question. I did have kidney stones, which I think were the cause of my chronic kidney disease.
Well, I'm sorry to hear that. I mean, obviously, the usual tendency, like I said, you know, the question, you just answered my question. Clearly, you had kidney stones, and the kidney stones, when they obstruct the flow of the urine, it results in something called obstructive uropathy. So the urine which should be going out is going back on itself into the kidney and destroying it. And that can cause scarring, and that can cause the blood pressure to go up, and that can cause problems. So a way of actually allowing that to heal and allowing the urine to come out, which is what it's supposed to do anyway, because if it goes back onto the body, then clearly it causes blood poisoning. So therefore they put this tube, which will be like a bypass, if you like, to allow for that to happen. And in a way, maybe allowing the kidney to heal and get to that level where they can take the tube out and then allow the kidney to function. Obviously, as I say, the urologists are best placed to decide when. They might suggest surgery to you, but they can never force you to undergo surgery if you are of sane mind, i.e. you've got capacity to make that decision. The only time they would make that override, if you like, is when they would be acting in your best interest if you lack capacity to make that decision. But usually they work in tandem with you, because that's the way we work. We end up in a better outcome when we have the patients working with us, the family. When we're in tandem, when we're in cahoot, we actually defeat a lot of things. It's when we go separately, my mind is set on this and you as a patient is set on that, it becomes a bit of a mismatch, because a bit of an impasse, and that becomes really undesirable and it ends in tears. So if they suggest that to you and you are opposed to that, then I think they'll have to respect that.
Is there a comeback?
Say again?
No, I'm asking Lorna if...
All right, so you wanting a rebuttal, yeah? All right, she's waving and blowing kisses.
Okay, all right, then that's fine. So, Doc, yeah, well, I mean, we're wrapping up, but there's a question about what causes kidney stones.
Oh boy, you don't want to be started on that. Right, kidney stones. Mainly the concentration of the urine is one thing that causes that. But you see, kidney stones have, what's the word for it? They have a multifactorial, if you like, development. Sometimes it could mean the functioning of the kidney is not good. Therefore, the concentrated urine will start becoming something like a deposit, like a residue. And that over the time will become something like sand. And that sand will become something like bigger stones, if you like. And then, of course, maybe you lift something a bit heavy, and then that stone, which was there for a number of years and has been dormant, then dislodges itself and gets into the tube, which is a narrow thing. And that can cause you problems like nothing else. Men equate it to labor pain. Now, I don't know why men say that, because I'm yet to see a man who's had a baby, but never. I think Arnold Schwarzenegger had a baby in junior, but that's one thing. But the fact remains simple, that when we have somebody who's got kidney stones, we need to establish whether the calcium, now that's the element that actually helps in the production of the bone. So if calcium is high, then that would need to be looked at. So when the stone is passed, sometimes we look at the component parts. Yeah, the parts of it. What makeup is it? Is it granite? Is it oxalate? Is it calcite? There's a lot there. And as I say, sometimes because we just mentioned the kidney being malfunctioning, and therefore it narrows, it causes the scarring, and that in itself can obstruct the flow of urine. And because it's not flowing as it should, clearly it becomes a bit more acidic, and the acidic component of it will lead to the formation of the residue, and that can give rise over the years to the stone formation. So one way of actually treating it is finding out what the component part of the stone is, and of course looking at the kidney component, i.e. whether there's narrowing, whether there's valves that actually has caused this urine to actually stagnate and become acidic and then become residue and then stone later on. Is that helpful?
Right. Well, yeah. Is there any comeback on it? Okay. So thanks everyone for your patience, and once again, sincere apologies for the disruption and any offense caused. We're going to make sure we get Doc back. I'll arrange with him for either the last week of October or, a couple of Saturdays in November, so that we can devote, some more time and go through stuff. So any final words from yourself, Doc? But whilst Doc is giving his final words, if you want a copy of the slides, please, send me your email address privately, and we will make sure you get a copy. So far to you, Doc.
Yeah, no, thank you very much. As I said, there's two sessions. What I did was I stopped at that particular point, but then the second part of it is full of questions that people asked me that I actually formatted into questions and answer. It's like a Q&A session. That's the bottom bit. So what I did was presented the first bit that I've done now, and then the second bit was more a recap of the first bit plus the question and answer session, which obviously was well received as well in my community. Now, I thank you so much for having me, and as I say, it's a pleasure to share the knowledge that I have. And as I say, I'll be guided by yourselves. Whatever it is you think I can help with, it's good for me. I'll try and fit it in my schedule and see how we go from there. But it's important to bear in mind that we have to take responsibility for our own health. This is something that we don't do in our community. Nobody can do it for us. We have to be, the sole architects, the sole, if you like, masters of our destiny, and therefore we have to remember that hypertension is a silent killer. And therefore it catches you by surprise, and therefore you need to pay attention to it and attend to it in time. You know the saying, a stitch in time saves 9? Well, it applies to this particular situation. This is a killer. It kills people like nothing else. Therefore, look after it before it looks after you. Thank you so much for that.
Thank you very much, Doc. And to everyone, please don't miss out on our health hour. All our medical professionals have been talking about exercising, and we usually have it on Tuesday evenings between 6:30 and 7:30. Just check the link on our website. And then also very important, on Wednesday, we're launching Black History Month celebration for Greater Manchester. So I want to invite, all of you, please, if you haven't registered, the flyer is on any of our social media, and it's in the chat box as well. We have our mayor, we have other civic leaders, who will be joining us for this very important event. So once again, thanks for your time, and we look forward to seeing you next Saturday as well. I think next Saturday might be focused on, we're going to have a cardiologist and talking about heart attacks and, how to make sure you keep your heart healthy. So once again, thanks everyone for your time. Dr. Kamara, we're really grateful for, all the time you give, and, I will be in touch. And if you could email me the slides, we will make sure that by Monday, we send it to all those who have given us their email addresses. But we're really grateful for all your support, and we look forward to having you back.
Thank you so much.
Okay, great.
Thank
Bye,
you.
everyone.
Bye.
Bye.
Oh, bye.
Oh, thank you very
Thank
much.
you.
That's that.
Thank you very much,
That's the
Charles.
icing on the cake.
Bye.
Bye.
Bye, doctor. Thank you.
Bye. Thank you.
Thank
Bye.
Thank you. Thank you,
Thank you.
Bye.
Bye bye.
Bye.
Bye, everybody.